So this is video number 2. If you've been following along, we're doing 9 to 10 videos taking you through pregnancy and delivery and all that jazz. And my name is Christabel Samy. I'm a GP in Rockingham and I own a business called Samy Medical Practice.
Yes, I'm Norafiah, I'm a midwife and I'm here at Samy's.
So the first video, if you missed it, was just essentially about us. So watch that if you've missed it. But today we kind of wanted to talk about what was your title? In fact, Norafiah had such a clever title.
My title was
Baby on the Brain. Because, you know, you're with your partner and you may be thinking, do we want to have a baby? And so we've just got a couple of things to think about. And how we've tried to do it is things from a medical point of view. So I'll try and give you a little bit of that. But also, Norafiah's got lots of things that you might consider, you know, things that you didn't even think about. And we're not saying this is what you should do at all. We're just giving you some ideas and some talking points and thinking points. So you might do some of it, you might do all of it, you might do none of it. You might just see what happens, where the road takes you.
Exactly.
So the question we get asked a lot is, should you be having a baby, maybe? So, you know.
Well, I guess that's one of the considerations. What I have noticed is that sometimes it's a surprise pregnancy, right? And or it's like one partner.
One partner is thinking,
and then also, you know, the state of the world, and not that we're trying to get too serious with politics or anything like that, but people are becoming more socially responsible.
Exactly.
You know, they want to do all the right things and contribute positively to the planet. So a lot of people are really being very conscious about, you know, do they want to have children to start off with? And so something to, I guess, start a conversation with your partner, because if that's what you're feeling, that you want to have a baby, you need to check in with your partner that they're ready to have a baby as well.
And you both need to be on the same page at the same time.
Absolutely.
I do see it a lot, actually, where I have sometimes women who come in and they don't really feel ready, but they maybe feel some pressures, be it cultural or with their partners, or and they're kind of wanting to try but not really. So have those conversations, because a baby is forever.
Yes.
Like, I don't think you can return it. It's not like Target where you've got a 30-day refund policy.
No, that's right.
So have a bit of thinking into being, because we're a socially aware practice. So is it, you know, is that in your future? Is it the right time financially? All that sort of jazz.
So that all that is very, very important. And so being conscious of, you know, what you're planning, what you're going to embark on. And it's always nicer when, you know, both parents are in alignment anyway.
Makes it easier.
It makes it a lot easier
as well. And there's some spiritual aspects as well as part of that. So some people, you know, have different belief systems. Like
so that's something. What was in my notes on here?
We've written some notes and we digress a little bit.
Conscious conception. So that's where, and I know this might be a little bit out of the sphere.
We're just talking about theories and things that people use.
So what you know, it's what you may want to consider doing is call in like the spirit of a baby, you know, to come in for both yourself and your partner. And I think that's a really nice way, because babies are sentient beings even when they're inside. And I always encourage like parents to talk to their the mums to talk
and listen to music. That's why people say listen to music.
Listen to music and all that.
And you know those sayings like they would have started in the olden days. I'm sure I wasn't alive, obviously, but you know, everything happens for a reason, and all of that comes from that awareness of the spiritual being, whether you're religious or not. You know, being kind of things happen for a reason, and one door opens and another one opens, it closes, and you know, all that jazz, whatever it is.
So that I think is something to kind of be aware of, or you know, start to have the conversation with your partner. And not everyone
has to have a baby to be content.
No,
that's the other big thing.
That's right.
And it's some couples, they don't need to feel you know, odd if their choice is not to have a baby.
And sometimes it's not even something that you know, purposely plan that you don't want to, and there's, you know, no judgment on women who do decide, I actually don't want to have children in this lifetime, or you find out that actually we can't, and so then that is a huge thing,
and that becomes
mentally and emotionally for women to kind of to go through. And I always say to women, like, even if you don't think that you're ready to have a baby now, but potentially if it's in your future, no matter how young you are, you have to start looking after yourself now, because there's no point getting to that age, like, I don't know,
and thinking
30,
things are going to happen.
exactly,
Yeah.
and it doesn't, right?
Yeah.
So then you get really disappointed, or you beat up on yourself. So
and then a couple of sort of medical things that I get asked a lot. Some women come in and they say, do I need to come and see the doctor before I start trying for a baby? I get asked that a lot. Generally, my viewpoint is that you don't necessarily need to. I think there are a couple of cases where I would probably recommend that you do. So if you take any medication or you have medical problems, it's sometimes a good idea before you start trying for us to just look at the impact of that. So one of the ones I get asked a lot is sort of antidepressants or anxiety medication and falling pregnant, and there's a whole discussion around that. So that's a good idea to come in before. If you've got diabetes or if there's been thyroid problems, that can affect some of the things that we do during pregnancy, so it would be helpful before. And, you know, high blood pressure, that's another kind of big one. But generally, I would say if you're not taking medication and you have no reason to be unhealthy from a medical point of view, you don't necessarily need to see me if you don't want to. And the other thing that I would sort of say is if you kind of decided, I want to try, folic acid is important because it is preventing spinal cord problems when the baby is developing, and often that occurs before women even know they're pregnant.
Absolutely.
So that's why we actually say to maybe take folic acid as you're trying, because then it kind of kicks in when it needs to and if it needs to.
So that was the some of the things that I had written down. It's about when you're mentally, emotionally ready, looking at your physical health, so knowing what your nutritional status is, how you're eating all the right foods, and sometimes it goes beyond just making sure you have, 3 veg, 4 fruits, or whatever it is. It is, getting a little bit deeper than that, because if you have certain conditions, I don't know if you have gut issues or whatever.
Even if you're vegetarian or you don't eat a lot of meat, if you're low in iron, that can actually affect conception and fertility a little bit. So that's a good thing to kind of be aware of before.
Yeah, absolutely. Your hormones, like you need to make sure that your hormones are balanced. And I think women's hormones get a really bad rap because it's always like, your hormones are
and there's quite a lot. It's hard to kind of know what to do. Generally, I would say if you're getting a regular period, you shouldn't have an obvious problem if there is going to be a problem. So that's kind of, if you're getting a regular period, you wouldn't necessarily need to see the doctor before you start.
No, not at all. But definitely, like, knowing your menstrual cycle, like, are they regular? Do you know where your fertile window is? So there's cool, like, if you're not used to tracking your periods, there's lots of apps. So
many period apps, I didn't even know there was a market in it, to be honest.
And there's other ways too where you can track your body changes naturally. So as an example, Christabel, did you know that when we are in our fertile window, our vaginal mucus is very stretchy?
I did. I heard that only because apparently I've heard very, very Christian people who would use contraception, who don't use traditional contraception, they would use that as one of the ways.
Was it the rhythm method?
But you can buy kits, I believe.
You can buy kits
that are testing that. And they do that in many cultures and countries, actually.
Yes. So definitely, like, getting to know your menstrual cycle, knowing your body, but also making sure that your partner's doing his bit as well, because don't just leave it up to us.
Sometimes it's not just the lady.
Absolutely.
Even though the men love to blame us for everything.
Absolutely.
We are amazing sometimes.
A lot of the time. Thank you, Christabel.
Never do the wrong thing.
I mean, does he have dodgy sperm?
I love it.
Not very fast swimmers.
It's true, because women actually beat themselves up all the time.
Totally.
I see it a lot. They assume it's them. It can be. It takes two to tango.
Yeah.
Hey, I think that's a movie.
Right.
And actually on that, I was looking a little bit into the medical point of view in terms of sort of weight and does that affect fertility. And we've always known that women, if you're very underweight or very overweight, that does actually affect fertility. But interestingly, men, that actually affects their fertility. So if they're very overweight, it does. But I think we forget that. I can't think of any woman who's come in and said, it's probably because my husband loves chocolate. And
because as per usual, everything's left to the woman to sort out and to go to the doctors.
Right. So everyone.
we're not hating on men here. We are not
have to be
hating on men
healthy.
here. Exactly.
And also, actually, whatever, if men are on certain medications, that can actually affect fertility and whether it's the right time medically for you to have a baby. Yeah. So men also, need to be aware if they've got medical problems to think before.
Absolutely.
Start trying. I also I get asked a lot about sort of coffee and alcohol and smoking, when you're trying. And I guess the evidence is, look, if you can try not to binge drink, that's ideal. Yeah. Mainly because we don't know initially when we're pregnant sometimes.
Absolutely.
And that's where the damage is done.
Yeah.
But also just being careful with caffeine. So I love coffee, but you do really have to restrict some of your caffeine intake if you drink a lot, because that can increase chances of miscarriage and problems early on. And obviously smoking you shouldn't do.
No.
In general.
Or restrict. Just restrict. Yeah, because it's not good for your health in that anyway. But hey, but in saying all that, if you go out on a bender and then find out a month later that you're pregnant, don't stress.
A lot of women come in and they're really stressed. Some haven't actually told their spouses because they're that embarrassed. And actually, a lot of women, it happens, and it most often doesn't cause any problems.
No, that's right. And I guess the point of that is because particularly if you've been trying, and there are lots of stories of women saying they've been trying for so long. They've been very, strict or whatever, and then decided, bugger it, let's just forget about it, and then go out and go on holiday, and then suddenly they're bloody pregnant. So,
So it's something about relaxing, because actually that's a really good point.
Stress, isn't it?
I tell a lot of women, if you're wanting to try to get pregnant, just to have regular sex, essentially. 3 times a week, that's a lot of the sort of evidence says just regular intercourse. You don't even have to track your cycles. You can, but if you're getting a regular period, just take the stress out of it. Make it fun.
Okay? Make it fun.
Because a lot of women, I worked in the UK, and a lot of women fell pregnant during fertility treatment naturally. Yeah. Partially because I think they were too stressed before, and once they'd spoken to a doctor and maybe got some assistance or thought they were getting that, they relaxed a little bit. Yeah. So regular intercourse 3 times, not timed, not stressed. Yeah. And if you do want to maximize your chances and you're tracking your cycle on one of those apps, the best sort of medical fertile window is actually 5 days before you're ovulating. And that's if you're only going to have sex on those days, that's the ones to do it on. And if you want to know how to calculate your fertile window, lots of the apps do it, but you can also just plug it in online and do that. But
and I was telling Christabel, here's a little fun woo-woo thing, and if you follow astrology, so but you have to get your like a full astrology chart done. So you have to know the time and place of birth and your date of birth, and then you work out what the moon phase is when you were born, and then that is your second fertile window. So I do know a really good astrologist who can work that out for you. Just to plug that for a friend.
And actually, when Norafiah was telling me about this, I thought, oh, that's strange, because my family are traditionally from South India, and I remember my grandma telling me that friends of the family or whatever were going to have an arranged marriage, which is very common in certain parts of India and other countries actually. And they always look at whether the match is going to be compatible before they arrange the marriage. And my grandma would always ask things like, oh, apparently she was born at the wrong time. And I'm thinking, I don't understand where this is coming from, how that is, whether you walk down the aisle with somebody. But it's probably based on that. And I was saying to Norafiah, that's kind of cool. So they do that in a lot of cultures. And it can that fertile window,
and it can possibly explain where some women, like they're on contraception or whatever, or and then they're thinking this isn't my fertile window, and then whammo, they're pregnant. I'm like, well, that's not even in my.
Which is why we say to have regular intercourse and not get too concerned about the actual app and the days that you're ovulating and blah blah blah. Just have fun.
Absolutely.
And just a couple of facts, because I also get a lot of people get very stressed if nothing's happened after just a few short months. And I wanted to just mention this: out of 100 couples, only 20 will actually fall pregnant within a month. 72 by 6 months, and 92 of those couples by 2 years.
Yeah.
So essentially, it takes a while.
It does.
We all hear those stories because women come in and they've obviously feel a little bit disheartened if things haven't happened in maybe 3 or 6 months or whatever. And I think it's because as women, as ladies, when we're chatting, if let's say we're having coffee, I would love to tell the story of how I came off the pill and suddenly, bang, without even trying, I got pregnant. Yeah. Nobody actually sits and really says, except to a few close friends maybe or family, actually we've been struggling for a little while. Yeah. I think it's a little bit of a taboo topic. Women still feel a little bit ashamed or like they're not
doing inadequate. Because,
inadequate, that's the word.
When after contraception and then you're not pregnant and that's what you're trying to do.
So the truth is it actually does take a lot longer than maybe we would think from movies and talking to people.
Because I suppose the fact that there's like loads of women, pregnant, and it just kind of gives you this perception like it's just
it's really easy
to fall pregnant, but it's not, because when you think about it, you only release one egg every month, and then you're dependent on
the sperm and the quality of them as well.
Exactly.
How long they've stayed alive.
So that's like a one in a how many sperm is injected? Like a million, whatever.
Yeah.
Let's just say it's a million. So that's like a 1 in a million chance.
Yeah.
Every month. So
that's if you've had sex at the right times as well.
So it's actually quite difficult, I think.
Yeah, and it takes longer than you would think.
And it takes longer. And then if you're stressed about it, you're not looking after yourself health-wise and all that, then of course it's going to take longer.
And you're thinking about timings and things. You then release lots of stress hormones and the body is out of whack.
Absolutely.
And what I always say to people as a general rule, and this is guideline evidence-based, we would sort of recommend if you're over 35 that you give yourself about 6 months of trying and then maybe just touch base with your family doctor. They might not do anything further than just have a chat to you and find out, but that's a good time. 6 months if you're over 35, just because of the age impacts on fertility, I suppose, as a general.
I don't really go for the age thing.
Yeah, which to be fair, and that's interesting actually, because I know somebody who is from the Philippines, and she was a little bit older, and she said that actually women in the Philippines are having babies, loads of babies in their late 40s. Yeah. So there's a lot of factors at play, but just from coming into the doctors, just have a chat. We still might not do very much. And if you're under 35...
I'm like nodding.
I still don't do anything, actually, to be fair. But if you're under 35, give yourself a year because it's still normal.
Yeah.
And most people will go on to have a pregnancy. As long as you don't have any conditions where you think it might be an issue, take some time, step back.
Yeah. So I guess that's really the key points, isn't it? It's like your health.
Yes.
It's your health.
If you're healthy, you're not stressed, looking after yourself,
absolutely,
getting a regular period. Because if you're not getting regular periods, you would need to maybe see the doctor a little bit earlier. Yeah, because there may be a delay.
That's what you need to sort out. Yeah.
So hopefully we've given you a couple of things to think about. There's more than a couple of things. There's a lot to think about because having a baby is a big decision.
It is a huge decision.
And when and if and how you do it.
And how.
There's a lot out there. So we wanted to touch base on some medical things and some kind of astrological alternative things to think about. And hopefully it helps you guys make your decisions. The next video will be on
now you're pregnant.
Yeah. Well, we had a really funny title. Woohoo! Woohoo! You're pregnant!
Now what?
You can't drink. Now what? So that's what the next video is going to be, and some common things to think about.
Yeah.
So thank you for watching.
Thank
Subscribe
you
to our video, and we'll see you next Tuesday.
Bye.